My name is Erin, and I live in Orlando, Florida. There are three people in my family. I have my husband and my son Landon, who's 8 years old. So basically, Landon was diagnosed with cancer in 2021, and he's done with treatment, but we have a lot of after effects of cancer treatment. He has a lot of issues medically that we have to go to many appointments. We're constantly at the hospital, and we face a lot of skills of academic skills he lost due to treatment, and also like basic life skills. His fine motor skills are behind by 3 years, if not more. It's overwhelming and so much. We just can't. It's so hard to like function and afford all of this. We have KidCare and it's pricey, but also there's a lot of issues with them not covering his his OTPT and speech therapies. So he's been out of those therapies for almost 3 months now, and I noticed a regression of his skills that he built up during those therapies. But Landon's on the KidCare plan that is not made for disabled kids. Basically, I have to spend a lot of time navigating his health journey with doctor's appointments, um, making sure that the, that he's receiving his therapies in school because right now we don't have things we don't have the therapies for us right now. So I have to make sure he's getting his therapies in school. Basically, the OT at school is not the same as OT in a medical setting because OT only practices like pretty much handwriting, like your fine motor tools. While Landon needs more strengthening of his whole upper body so he can actually write because KidCare only wants to cover 8 weeks of OT, PT, and speech, where my son requires a lot more of that. Landon needs to be on CMS KidCare, which is only offered for subsidized people that can get subsidized KidCare, and we don't qualify for that. So my son is not being given the care he deserves because I make too much money. So basically, Landon's being punished for his parents working. I expected the state to help me when I needed it by giving him the care he needs. They automatically send these kids to KidCare full pay that are disabled because I'm not the only one, and they think they have this great coverage. We paid $260 a month for this great coverage. It's going to cover his OT, PT, and speech. And then when they get to the speech place, they're like, "Oh no, it's not covered." It's just so wrong. KidCare, I know what I'm getting, but like I said, it's not adequate care for a cancer kid or a kid with life-threatening illnesses. Now I have to pick my and choose. Like I have to pick and choose of what to pay for. Like I have a mortgage payment on the first of the month. I have KidCare, which doesn't follow the federal law. When I can get kicked off if I don't pay on the first of the month. I have to pay those two bills, or he doesn't have a house, or he doesn't have health care, and that's a life and death situation for Landon. I'm angry and I'm like sad at the same time. So I just feel like I'm being like my son is being punished for something that he has no control over. My question for the Florida legislators are why is it's been 2 years since you passed this 300% law. We're almost going on 2 years. We would qualify for subsidized coverage if you would just pass the 300. I'm at a loss. Like why are you punishing kids? You don't want to help kids that are sick or dying or disabled? That's sad. Basically, I would love to see Landon thrive as an independent adult with his independent life, with a family and a successful job, and just love his life. But right now, with that happening, he can't even dress himself right now. So I don't know what life looks like for him, and that's scary for a parent.